Okay, hello everybody. My name's Steve Miccio. I am the CEO of a company called People USA. We are in New York State. We serve many counties in New York State. We are a peer-run organization, and I'm really happy to be here today to talk about shifting the paradigm through peer services on in mobile crisis teams. We have many services that we have, but we'll focus today mostly on the mobile crisis teams. But I do want to give you a little history of who we are and what we have done over the years. So the foundations of People USA actually started when the psychiatric centers in New York were still filled with thousands and thousands of people. And when President Kennedy signed his mental health law to close down these centers throughout the country, New York started to do that. And in the 60s and 70s, we saw a lot of the deinstitutionalization of the closure of beds in psychiatric centers. And out of that was born advocacy groups that were peer run, people with lived experience coming out of the hospitals and either being funded or voluntarily starting to advocate for the systems of care so that people were coming out of hospitals and getting some kind of advocacy behind them to ensure that they're going to get some care in our mental health system. Unfortunately, when President died, um, the the values that he had behind of deinstitutionalizing our systems of care wasn't followed through with a good business plan in our country. And a lot of what we saw was trans-institutionalization over the years, where people ended up in jails and prisons that used to live in psychiatric centers. And it's unfortunate that that happened, but that's why we were there. We were the human rights movement to ensure that people were getting treated appropriately and with the care that they deserve. And our mission was founded on the on dignity and rights and self-determination because we believe a lot of people have choice in their quality of care, and they weren't necessarily being given that opportunity. So it did lead us into um, peer-led crisis support and compassionate service models. We were originally just a advocacy organization, and in 2000, the end of 2000, 2001, I made the decision to start to provide services, and we got into supported housing services. We got into placing peers in hospital emergency rooms to engage and greet people as they came in. We developed respite houses. Many of you may know about respite houses in our nation. We developed those in partnership with Sherry Mead way back in 2001 and have seen that grow exponentially now in the United States, where we're seeing more and more peer respites come to fruition, which are simply bed and breakfast type environment, beautiful environment houses where they are peer run and people can come and stay, up to about 7 days. It varies on what state you're in. And learn how to break the cycle of going from home to crisis to hospital. And that was one of our major contributions to the behavioral health system as a peer-run organization back in 2001. So we did shift our work into more of a non-traditional crisis service delivery system. We didn't at that time have mobile crisis teams back in the early 2000s, but we did have mobile staff, and we were out there greeting people, similar to what a mobile crisis team does, trying to help them navigate the system of care in their communities. And it was a bit of a challenge because also remember we are a peer-run organization, um, and when I say that, we're all in the organization lived experience, whether it's substance use or mental health or both. And our integrity wasn't very high. We weren't a very trusted system at that point, when we were providing those services. And it was unfortunate because a lot of it was stigma, thinking that the peers were, trying to take over the asylums or the system of care or whatever. Our whole goal was really to focus on dignity and respect and providing quality service to the people in our communities because of our lived experience and our mutuality. It was important for us to never forget that, never forget where we came from, and to provide a better way or an alternative way. Unfortunately, we had to call it that, of providing a service that was more compassionate, non-coercive, and focused on just supporting people and empowering people to make decisions with or on their own uh, for a better quality of life. And so this evolution reflects a culture shift, recognizing that these lived experiences, they 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 better support people to offer trauma-free or and person-centered care. And I'll talk more about that, because we all use the term person-centered care now, and the term of, putting peers on the teams and things like that. But I think we should always ask the question is, are we really making that difference? Are we making a difference in the quality of care that we provide people in our communities? So the peer-run crisis team model is really one of my favorites. I mean, everything we do at the organization is one of my favorites, but being able to have a team out there, and we have right now 5 teams in different parts of the state, um, and to respond to somebody is to me an awesome thing because we respond quickly, we respond effectively, we put a lot of values into our work. So when I say non-coercive peer support, it does emphasize that we don't want to force people into something. We don't want to induce more trauma on people when we meet them in communities. Sometimes we do have some co-responder work that we do. We have non-co-responder teams. We've mixed it up. The reason I got into the co-responder is because I believe it can be done better, with peers. I think that we can build great relationships with police departments, and we have, and I can talk more about that, to build a trusting relationship where maybe it doesn't have to always be a co-responder anymore. It can be just the police department calling our peers and saying, "Hey, there's a situation happening," and sending the peer team into it, rather than having to pull an officer, off of patrol and having them be a part of it. But having that opportunity to be able to work with the police department. Um, we respect autonomy, supporting personal agency, ensuring emotional safety and empowerment for the people during crises. The core commitments, respect, dignity, empathy, curiosity. This is all at the forefront of our service. This is not an afterthought. This is something that we put a lot of time and energy and training into to make sure that our staff are prepared to greet people in our community with this focus of our core commitments and building trust. And we find that the mutuality builds a lot of trust when our staff can share, some of their lived experience, share some of their situations that they've maybe had where they've learned from those, and they can share that with the people in our communities. It also comes down to a lot of values too, and our values really, we don't just put our values up on the wall and say, oh, that's what it's what we value. We've put a lot of work into training what our values look like, so it's not just honesty. It's honesty of understanding that sometimes we know answers, sometimes we don't know answers, but we know where to find answers and sharing that with people. The compassion comes from a lot of the lived experience. When you've been through something that's been traumatic and you've survived it and you've grown from it, and now you have the opportunity to give back, there's a lot of compassion that goes into that. The community is so important. We're serving our communities. So we think of that as not just serving a community, but we're also using public dollars to serve our community, and we don't want to ever forget that. And so we infuse that into our service delivery. That's the authenticity that we put in there. The courage to admit that you're a peer, a person with lived experience, the courage to engage in a very non-threatening way, and working with the people that we do. The mutuality, as I said, is so important. Um, in providing that relationship, and that's what's building our trust. The advocacy that goes into everything we do. We started out as an advocacy agency, and we are still an advocacy agency. So we still focus on that. And then the peer support that we provide people beyond just the mobile team, the peer support groups that we've started, the peer support work that we're doing in community. And then equity, we don't rank ourselves in any hierarchy of position to anyone we serve. And it's important to do that because people see it and they feel it, when they're seeing that. And then innovation is a value that we just naturally grew into. It evolved with us when we started putting the peers in emergency rooms, when we started the respite houses. We now have peer-run crisis stabilization centers. We have two now that we're operating that are all peer-driven from the psychiatrist on down. People with lived experience providing these services, and to us it's so important. And of course, our mobile teams. When we have clinicians that disclose as peers, they became clinicians because they started out in the world of being treated for services. And we've been able to find these great clinicians that put their heart and their energy and their compassion into everything that they do, and that we can provide and support. So we do value the trauma-free practices of empowerment and self-determination. What does that look like? That's where we prioritize our empowerment and our education and avoiding the coercion. So we're very honest. We're saying, well, if you don't take this path, here's what could happen to you. Here's what, it'll get involved in the legal system, the justice system. You might be incarcerated in a psychiatric hospital. These are all the options that are real that could happen. But if we can work on this together and avoid that coercion, we can get you into the services that you deserve prior to getting to that level of needing that more intensive services, or that, um, more incarcerated service, I should say. Trauma-informed engagement, creating that emotional safety. And again, that's the values that I just talked about, and how we infuse that into our conversations. And we don't go out and just with a clipboard and asking questions. And I know a lot of teams don't do that, but we really try to stay away from that. Try to make everything a conversation of understanding. We adopted this terminology of take a minute. And we found out that in traditional mental health settings, with a clinician or a psychiatrist, or someone that's serving another person, we found that the average amount of time that they wait to interrupt a person telling a story or their story is about 14 seconds. And we found out that if you gave someone 47 seconds, you would get more information about the individual that would help you understand what it is they're going through. So we adopted, let's take a minute. Let's just take a minute to listen to somebody instead of trying to interrupt or trying to kind of drive the conversation. And we find that that works tremendously in building trust and also understanding an individual and what their needs are better. The compassionate communication, avoiding those threats and demands, but providing the education on what could happen, to an individual should they make different decisions that maybe some of us wouldn't want to make. And then centering around that lived experience is a tremendous value to the services we do. So how do you do that? How do you build and run the training and the peer run crisis teams and things like that? Well, I'll be honest, it took 20 years of doing this. I'm in my 26th year at the helm of the organization, and it took a long time to figure this out. Before going back to when I got the permission and the contract to put peers in the emergency room, there wasn't a training manual on doing that. When I opened the first respite house, there was no training manual. Um, we had to create the training behind it, and we wanted that training to be holistic and make sense. So, motivational interviewing became important. Um, Listening skills. We do a lot of work around listening skills when we onboard our staff to help them to understand how important it is to listen to the person in front of you and not get into these predetermined thoughts and processes while you're listening to a story. Um, we do a comprehensive onboarding with a lot of that training, the historical aspects of where we came from as an organization, from the grounds of psychiatric centers to where we are today as an integrated and important organization has been a lot of work, and it's taken time to build that value that the community has now in us. That integrity didn't just come overnight. It took years of doing that. Um, that reinforcing the values, and we have a team within our quality assurance and the organization that revisits the values consistently so that we make sure that we are following through on our values with the people that we're serving. So there's a lot that goes into this. Um, the empathetic communication skills, the recognizing and honoring trauma. We know a lot about the ACEs, and I know a lot of teams bring that up in their outcomes and their outputs and their documentation. Um, but do we really honor the trauma? Do we understand it? And I think having my teams having gone through the trauma and remembering what that was like and building on that education, that knowledge that they gained, of coming out of that traumatic world, is so important in really honoring people's trauma. So we embrace that. The crisis navigation of solving and grounding, providing, problem solving and grounding exercises and offering choices, to avoid force, has been really important. When we first started our mobile teams, one of the teams we were starting, actually two of the teams were in Yonkers, and Yonkers is the third largest city in New York. It's got a lot of people. Um, and the Yonkers Police Department did not embrace this. This was coming from, we contracted with the county who wanted to infuse uh, mobile teams into the Westchester County community. And so we weren't the only organization providing mobile team services, but we were the only one providing Yonkers with the team. And Yonkers had or has four precincts. It's that large, there are that many officers and police presence in Yonkers because it's a big city. Um, it took us 2 years working with the police department, trying to show them the value of the peers and the clinicians and who we were before they started to embrace what we were doing. And now they're one of our best partners um, in all of our teams because they understand how to utilize the teams without overburdening their precincts. And that's where I was talking about. It was started out as a co-responder where we would meet the officer and excuse me, where we would meet the officer in community. And now it's more of if there is, criteria around the safety issues, because I know a lot of people have, concern of safety with mobile teams. My team will determine in partnership with the police department whether that's a safe, independent visit that can be made. And we've been doing this now for our third year of the good partnership. So we're in our fifth year of doing this. Um, where we've had no issues of the staff going out without the police presence and engaging. Or if there is a police presence, they're down the street, they're close by or whatever, and they can be, brought into the situation when needed. But it's been a much healthier relationship between the Yonkers Police Department and my teams. It's so much so that we've expanded into other towns in Westchester that they've seen the outcomes, they've seen the outputs, they've seen the value and the successes of the teams out there. And so that's been a big part of building this is that you can't do it without building your team, without building that training, without building the question of are we making a difference and how do we know? So we've infused now into our outcomes the 8 dimensions of wellness for people. We've had infused the quality of life questions, and we follow through with people. So, we're starting to term this as a depth of care. It's not just a mobile team going out, doing their thing, getting them involved in services, but the follow-up becomes more important for us. And the follow-up goes beyond just checking in and saying, how's it going? The teams will often reach out even after a crisis call, to someone to offer additional advice, additional education, additional support. And it's pretty incredible to see what the teams are now doing, with those folks. So it's really more of a depth of continuum of care that we've embraced in the organization, and we're really enjoying that. It's ongoing coaching and reflection with our teams, strengthening skills, ensuring compassionate, effective, peer-led crisis intervention. It's extremely important to me and to our teams and to our leadership in the organization. And it shows in the integrity, as I said, that we built as an organization, a peer-run organization. So the impact and outcomes, it's just showing us in our outcomes that it's a trauma-free support and trust. We're providing this non-coercive and promoting sustained recovery. So we're measuring that. We're seeing those outcomes of the people. We're reducing hospitalizations, reducing police intervention. If you look at sequential intercept mapping and you look at where you started, where you filled those gaps and all the different sequences, and where people are ending up now, we're infusing our staff into the courts. We're infusing our staff into more of the stabilization center growth and more of the respite growth. All those things are coming with the evolution of having effective teams out there. Empowerment and engagement. People just have a different outlook on themselves when they are empowered to make those decisions for themselves. Whether they're good ones or bad ones, at least they're getting the opportunity to be given the chance to do something different for themselves. And then improved community well-being. We do improve the quality of life. We strengthen community ties. We do promote long-term stability for those in crisis. But then you have to also think about your own team's internal wellness and health. And so we, again, have another internal committee that is our wellness committee that focuses on the strength of the staff, the opportunity to grow from, working in a crisis environment constantly can be demanding. And how are we supporting ourselves internally so that we can support those externally in the organization and in the communities? And that's something we constantly focus on. So in conclusion, the action steps are, if you're not hiring peers in your teams, you're missing out. I really believe you are. And if you need, the training, there's training out there on how to work together collaboratively as teams. Um, it is transformative for teams when they see the value, of the peers that come to live on the teams. The integration of the lived experience into the teams, into the crisis system, is showing improvements in the system, at least where we're working, where the systems of care are less siloed and working more collaboratively together. The advocacy for peer involvement and non-coercive engagement, it fosters a trauma-informed, compassionate crisis care. And it's showing up in the emergency room because they're our partners. It's showing up in the inpatient units because they're our partners, in the police departments because they're our partners. Um, we are the voice of the non-coercive practices. And you're never going to get away from coercion, and I know that. I'm being realistic. But for the most part, if you can reduce that by 80, 90%, I think it's a win for a community. Building trust in recovery, compassionate crisis systems, they improve outcomes, they build trust, they make recovery possible for individuals. And being able to grow a peer-run organization into a continuum of care and then sharing that and modeling that for the community services that we work with makes a big difference. And so this is something that is an evolution. It's still growing. We're still learning from it. We're still learning together. We're still learning how to collaborate better with one another. We really do reinforce continuously looking at our sequential intercept models and our sequential program models. So you have your sequential intercept, which is focused on criminal justice, but then you have your community mapping that I think is also just as important so that we can avoid, let's call that -1 instead of zero intercept. It's -1 intercept, which is prevention of getting even to the level of criminal justice and mapping your communities. And it's so important and easily done. If you have the leadership that works with you and wants to do something that's different and better for communities, talk about community mapping, not just sequential intercept mapping. I think it's important. So those are um, and this is a very high level, I think, overview of a peer-run organization evolving into a continuum of care, evolving into an integrated, integral part of services, and starting to take the lead on some of the behavioral health work that goes on in communities. It's an awesome and important responsibility. But I don't see why mobile teams can't grow from having peers on their teams. I think it's really vital and important, but it's then what do you do? What is that job description? What is that experience that you want your teams to have with having peers on your team? And where is that trust within the teams? And I think that's a situation across the country where some groups embrace peers on their teams and have that great trust, and then some groups do it because it's mandated to put a peer on the team, and some groups don't do it at all. And I think that's something I'd like to see evolve from a personal level into all the teams in our country, to where they are embracing the peers that are on their teams. So thank you very much for listening. I look forward to the questions. And again, thanks to AMSA for having this conference. I really appreciate it.